Welcome back to the Beyond Face Value Show. I'm Dr. Jill Wade, and I am here today to talk to you about what some people are calling the magic chair. Yes, the magic chair. What's that all about? Well, how about strengthening your pelvic floor? Not something that a lot of people come in talking to me as a dentist about right off the bat. But let me tell you, since we've gotten the magic chair in the office, I am shocked and amazed at once I open up the conversation, how many people are telling me that they are having constant daily issues with leaky bladders. And this is the only technique that I know out there right now, other than surgery, that is helping with this particular situation. Patients are loving it. They are feeling amazing effects so quickly. So I have brought in today with me as our guest host, Aurelia Byrne, who has been a hygienist in our office for many years. She is an amazing entrepreneur herself. So proud of her for all of the things that she has accomplished in the last, 5-6 years with all of that. And she is my little partner in crime in all things dental wellness spa that is happening and changing basically the shift that we're having in our whole dental practice.
I know.
I'm going to say it's a shift, right, Aurelia? But you and I know it's not really that big of a shift. We've been about total wellness, about dental wellness, and how the mouth is connected to the rest of our body for decades.
Yeah, total health.
This is not something new for us, but I do think it's new for people out there who might be first-time listeners or listening to some of these new techniques and products that we've been bringing into the office. And they're like, what? What is this? Dentistry? The magic chair? Leaky bladder? What? How do you fit that all together? So I'm kind of excited to start talking about this with you today. And so that people can really understand what's going on, because when we stop thinking of people as just their teeth, as just their cavity, as just their crown, and we think of people like we do as a whole person, a whole body, then it makes sense.
Oh, it's amazing to be able to treat somebody from total health. You know, you're helping someone all the way through and whatever they're struggling with, not just their smile or, their gum tissue. It's everything. Thank you so much for having me.
Absolutely.
I hope you have me a lot more.
I absolutely will.
So this is actually a really, really amazing topic for me, because there's a couple people in my family that have struggled with constant bladder infections too, which we can touch base on.
Yes, absolutely.
So how do we bring it into dentistry?
How do we bring it into dentistry? Okay, well, first of all, as a joke, I always, when I first brought this into the practice, the team was like, how are we going to start talking to people about incontinence? That just seems like a big stretch from dentistry to incontinence. And I said, well, those people who can't sit in my chair longer than 15 to 20 minutes before they ask me to get up and go to the bathroom for the 4th or 5th time, I'm pretty sure they're a candidate for this magic chair.
Yeah.
And that's just because that is an abnormally short period of time for you to be able to hold your bladder or what holds up underneath your bladder in order for you to be able to hold and not have to go to the bathroom. We have people that come to our practice who we're helping them with sleep and snore. And a huge amount of them also tell us in that questionnaire how many times they're getting up in the middle of the night. It's disrupting their sleep, because when they are having sleep issues, they then kind of come in and out of deeper sleep and then realize that they need to go to the restroom. So all these things really do tie together and work together. And so let's talk about just kind of the mechanics or the physicalness of what's happening with the hammock. Do you want to kind of talk about the hammock aspect of things?
So as we age, we have the bladder, and then it starts to loosen, like the muscles around there start to kind of to lose its form, and it comes into a little hammock.
Yeah, think of it like a hammock. When you have a really new tight hammock, it's
and then it starts to
bloop, bloop, and then as you use it, or somebody really heavy gets on it, then it's going to go down.
And then children too. When you start to have children,
a lot of women after we've had children or two, there's a lot of weight down there, and it really does stretch that whole hip and muscular area. Some of us, depending on how old we were when we had our children, I was 39 when I had the twins. Trust me, my muscles were kaput after that, all across the tummy, all in the bladder area. And so once we start having these conversations with women, I really started to realize just how many people do have a little bit of leakage when they laugh, when they cough, when they exercise, which is why we don't jump rope anymore. Like it's
embarrassing for some women to talk about it. It makes you feel like there's something wrong, so it's not a topic that you just share with people.
It isn't.
Yeah.
Until we start sharing. And then I realized just how many people it's affecting.
And I noticed that too, which has been pretty amazing.
It is really amazing. And the thing I get so excited about is that there is really nothing that I know of, non-invasive, non-surgical, to help with this. Like the only thing that I know of is the Emsella chair.
Yeah.
That's it. It's an electromagnetic stimulation in a chair. All you have to do is sit on it, kind of position yourself in the right spot in between let's say the front and the back. We want that vibration, that electromagnetic stimulation to go up in between those areas. And what it is doing is its target are the muscles, and it brings in the blood into the muscles and allows for the healing and the tightening of that particular muscle, which is a hammock that goes from front to back. When that tightens up, it literally is supporting the bladder and all the other good parts and pieces down there as well, men and women. And because of that, then that's where some of the leakage begins to stop. The control begins to happen better. I mean, this is life changing. Did you know, I just looked this up last week, that there are more adult diapers being purchased now than all the brands of baby diapers.
Wow.
So if that doesn't tell you how much of a bigger issue this is for hundreds of thousands of people. I mean, we're talking billions of dollars in
diapers, adult
diapers. So this has to be part of the problem. So yes, if you've had children, this could be an issue, but you cannot have had children and this can be an issue for you too, because muscles still age.
Yeah.
Gravity still happens. That same hammock. So imagine that this is the hammock that we're talking about down low. But imagine this hammock right here. It's the same thing in the what we call the chin area, the submentum. And so what happens as you get older, this same hammock, which now this one goes this direction.
Yep.
It can get loose. The muscles get less tight, and then you get the double chin. Nobody wants the double chin either.
No.
So just think about it. It's the same concept. This is what happens when we're getting older. This is what on the lower end of the body. That's what happens down there. So when you now have a solution that is non-surgical, I mean, people are going to be flocking to this chair. It is so easy. It's like 24 minutes. All you have to do is sit there. You got to take your jewelry off. Make sure you don't have like your Oura ring or your Fitbit on. You can't have had a hip replacement. Okay. The metal's too close to the area that we're trying to affect. You can't have a pacemaker, and you can't have like a pain stimulator. But other than that, there's really not a lot of other reasons that would keep you from being able to sit on the chair. And people are literally feeling a change like within days.
So can I talk about my personal experience?
Absolutely. Please do.
So again, I'm 51 and I haven't had any children. So, and I do yoga, I'm
very strong.
I mean, I've been working out all my life, and I've noticed like all of a sudden I'm like, oh, I have to go to the bathroom, and I'm like, okay, I can, I'll hold it. And then I'll like, what the heck? Like, I'm like, oh my God, I really got to go to the bathroom. Like, this is horrible. And then go. I'm like, geez, what is going on? And I thought, do I have a bladder infection? Like, what's going on? This is not normal for me.
Right.
And then here comes the Emsella. I'm like, well, my goodness. I sat on the chair, I've done the treatment, and Thank goodness, because now it's normal again. Like I'm like, oh, it must have, I mean, I feel like I use my pelvic floor to do a lot of yoga and do, but still, I mean, I'm 51 and I'm no children.
It just happens.
It's
called aging, guys.
Yeah. You would think that I wouldn't be the candidate, right? For that, because I
absolutely
didn't have any of those variables,
just
right?
The yoga and the stretching and the strength that I know that you personally have. I wouldn't have thought that you would be having issues either.
I know.
But you are, which just tells me that that's why the increase in the adult diapers. I mean, this is an issue for so many people, and I'm sure men just as much as women. Now, I'm going to say this with the caveat. There's still science to be done. I'm super intrigued, listeners, viewers, of what this machine might be able to do for men with prostate issues. I know that's going to sound a little crazy coming from a dentist, but I am super excited. We know that so many men are having, as they get older, as we all are living longer and getting older, that so many are having prostate issues. And I am just super excited to see, not just from a scientific white paper standpoint, but also from a clinical standpoint, to get our men sitting on the Emsella chair to see if this can help support them. Because it's an epidemic. I'm telling you, we'll do another episode on this, I am sure, as we find out more information
some
that
of
we
the
can
things
actually
that
share. But
men face is the stream, the urine stream. Like if you notice that you're having like a weaker stream, this kid,
absolutely. So
bring that power to it.
That's right. Bring the power back. Speaking of the power back, we're talking a lot about leakage and incontinence. And if that wasn't enough, okay, to me, that's huge. Like that would be enough. But there is a huge improvement in sexual wellness for both men and women with this device. So I'm just going to say that's an added benefit. Who doesn't need or want a little bit more of sexual wellness?
Sign me up. No. So, Dr. Wade, I wanted to say something. I have a couple, again, family members that are older, and like older, like my grandma, and she's 90. And then, some in-laws and like just even my mom, that they're older and they have some incontinence. So, but also my grandmother in general, she's suffered with bladder infections for a very long time. And she was just recently in hospital, and there's antibiotic after antibiotic. I mean, she's 90. So imagine how many, so she was antibiotic resistant. Right. So I would love to do a case study on my grandmother.
Absolutely.
Because basically she's not being able to squeeze all the urine out because the muscles are weak.
Muscles are weak.
So something lives in there. The bacteria just kind of hangs out in there and then causes an overall infection. Absolutely. And I don't think people are aware of how that actually can hinder someone.
And so for me, especially, well, men too, but especially the women, because I'm just thinking about pictures of, if you really study people and what their body kind of shape begins to look like as they age. For women, it's a lot of loss of even the stomach and abdomen area when they get a little bit older as well, even if they've been super, super fit and, super kind of what I would say flat belly for many, many years. So for us, especially with somebody older, we're highly suggesting to treat what we call core to the floor. Okay. Which means not only do we want you to sit on the Emsella chair and allow the electromagnetic stimulation to rise up underneath and support that hammock and that muscle there, but we also want to work from the top in the abdomen and stomach area to also strengthen above. So everything basically then from, let's say, the belly button down to, quote, the floor is stimulated to get stronger, much more, I'm going to say, core. Like, we just don't understand how important it is to keep your core. Now, if you've ever worked out with a trainer, ever went to aerobics, all the things I used to do from one of the time I was little, everybody's always talking about your core. Imagine the imaginary thread that goes basically up through the top of your head, down through the middle of it to your belly button and down. That's your core. Being in dentistry as many years as I have, a lot of my colleagues will not work on their core. Bend over with their shoulders. We're going to have this same issue. Even if people aren't in dentistry, what does this look like, guys? What position is this?
The computer, a cell phone, all of it.
Position,
the head
computer,
coming down.
the head down, the computers. We are going to see a surgence of this same core issue, like already rising. It's already rising. It's rising in teenagers, young adults, people that are working on their computers at home, in the offices, anywhere. Like this core trouble that I'm talking about is just about to be rampant, and not just in dentistry.
Yeah.
And so in dentistry, we've been dealing with it for years and having to really learn how to
bring
keep our shoulders back, do ergonomic kind of ways in our chairs. This is what Aurelia is so passionate about with all of her entrepreneurial things. And it's been a huge issue through dentistry. You have not seen what this will do to you, for those of you who are not in dentistry. But let me tell you, you talk about debilitating. It's just one thing after another after another. The rotator cuff goes. The neck surgeries have to start happening. I mean, you name it. It gets crazy.
Yep.
So mark my word, everybody who's going to keep holding on to their phones, keep looking down at computers, keep working that way, we all are going to have to really focus on this whole core to floor idea of keeping things strong.
So one of the things that I think is important for your listeners to know is it's like doing Kegels. We didn't mention that it's basically doing 11,000 Kegels in 26 minutes.
Impossible to do on your own. You might get 20 or 40 at a setting, but that's about it before you get bored and go off to do something else, right?
Exactly.
Well, I tell you, I'm going to kind of wrap this up a little bit. But I have had 3 women come into my office since we got the magic chair. And as I was just taking them on a little tour around, letting them know some of the new things that we had in the office, things that were coming and stuff like that. And 2 of those 3 women who I felt are young, so younger than me,
So like 19?
Yeah. You're so sweet. 29. They had recently, 2 of them had recently had surgery to lift their bladder.
Oh.
And were very disappointed to hear that they had never been told about this technology, never heard about this technology. And both of them said, I would have tried anything before having had that surgery.
Yeah.
And that it isn't 100% keeping them from being incontinent.
Ugh.
So I told them, give us 6 weeks post-op of your surgery, and then let's come back and try. Because again,
why not?
The initial healing and everything is fine. But if maybe this and that got tucked, but the muscle is still not strong, this is still going to go up core to floor. Remember, we're going to work on it from top and from the bottom and get them where their core is stronger. And so they're both really, really excited about, just trying something different, because they went through surgical technique to get things to stop and it still hasn't. It's very depressing for them. Very
that's
depressing.
A really good thing for your listeners to hear, because maybe there's a lot of people out there who've had this surgery and they need this maintenance.
Absolutely.
So that's I'm glad you brought that up.
And I'm glad you even said something about maintenance. Again, this is not a one and done forever. You are still going to age. You are still going to have some just normal muscle atrophy. Sorry, I can't speak. Muscle atrophy, just like anybody would with time and with age. So like dentistry, we do recare, we do recall, we do maintenance. You don't come in and get your teeth cleaned one
look
time.
at our hair.
Get it? Look at your hair.
I gotta get some maintenance.
Right on. So this is not an abnormal thing to think that you're going to have some maintenance. But hey, guess what? 20 minutes on something that is non-invasive, doesn't hurt, is so simple and so easy.
And it's effective.
And it's super effective. So I'm just super excited. If any of you guys or gals are having these types of issues, please give us a call. Come by the office, check it out. We'll give you a tour. We'll let you sit down on the chair just to experience it yourself so that you can just feel it and believe that it's not a big deal. It doesn't hurt or anything like that. So we are just super excited about all of this technology that we've brought into the office, but especially for the Emsella Magic Chair. And we want to share our magic with you. Thank you for listening today on the Beyond Face Value show. Thank you, Aurelia, for being here as our guest. And we are just super excited to keep bringing you all of this good information about how you can help yourself with longevity.
Also, to help us grow and expand our reach, be sure to like and subscribe to this show on YouTube or your favorite podcast platform such as Spotify, Apple Podcasts, or whatever you prefer. Just remember, it's time to live your legacy now. I'm Dr. Jill Wade, and this has been the Beyond Face Value Show. Until next time.